Hello, my name is Joyce Gibb. Thank you for being with me today. This is the viral season. We've had the viral season for 2 years now, but typically this time of the year, there are many viruses that appear, and they're usually upper respiratory viruses. One that's very common is called RSV, respiratory syncytial virus, and it was actually discovered in 1956. It's a virus that typically with most people and most kids and infants, it just becomes a cold. Typically the class of people that are affected worse by this are infants. But so usually when you get infected, it's winter, fall, and spring. Usually summer, it's devoid of this. But there were some this last summer. We had RSV last summer. And so they get a runny nose, decreased appetite, decreased PO intake. When it gets severe, they can't suck on a bottle without taking breaks. Coughing, sneezing, fever, and wheezing are very common, especially in infants. So these symptoms don't appear all at once. They typically appear in stages. And for very young infants, the only symptom may just be irritability, decreased activity, and they later on can have breathing difficulties. This is a lower respiratory illness in kids, and it's typically called bronchiolitis. And with infants, they start retracting right here, suprasternal retractions. They can have retractions in their ribs, and that's very common. They retract to get more air in just to compensate. The late sign is grunting. That's always a serious issue with kids. They should be evaluated before that. They typically have a really high respiratory rate to compensate. And what they have to do is when they're trying to eat, we recommend Pedialyte whenever they have RSV and they're trying to eat to get enough fluids in. But when they try to eat, they have to take frequent breaks because they just can't breathe and suck at the same time. It'd be like us trying to drink something while we're running a marathon. So the treatment typically for this is to manage the fever and sometimes pain if they have sore throat or whatever. The other thing that, they can alternate Tylenol and Motrin according to what your doctor says. Of course, do not give infants aspirin. And to evaluate if they're getting enough fluid in, you have to make sure that they have one wet diaper every 8 hours. And that's something that you can just compensate, tell the doctor about if they're getting dehydrated. They get dry mucous membranes, and then when they're breathing through their mouth all the time, their membranes get dry also. But you look right inside their lip, and if that's nice and moist, they are not dehydrated. But the other urinary part of it is they have to make sure that they are peeing every 8 hours. 1 to 2% of infants or children 6 months of age or under with RSV need hospitalized. So it's not very common hospitalization. There's a lot more kids that are at home and do perfectly well. They can have apnea with RSV, so that's something to be aware of, and stopping breathing. So the best thing for infants specifically is to elevate their head of their bed when they sleep. And so how do you do that? Most people, most parents put the infants in a car seat like type thing or a bouncy seat or something to have their head up when they sleep. It's just easier for them to breathe. And like I said, the most common thing is if you notice that they're having retractions, that needs evaluated. Suprasternal retractions, go to a pediatric ER or your pediatrician or your family doctor and have things evaluated to see if they need hospitalized for that. So, and the hospital does all kinds of testing. There are rarely kids that are intubated after they get RSV. Most kids, they put them on a nasal cannula, give them sometimes frequent breathing treatments in the hospital, but always get it evaluated sooner rather than later anytime you have an illness. Now remember, RSV is very common, and like I said, we had it late last spring too. So, all right, take care and let me know if you have any questions for your continued journey to good health. Thanks a lot. Thanks for listening. If you want to make sure you're getting the latest health information, click the subscribe button below and ring the bell. That way you can make sure you're not going to miss out on any of the latest information.